Your body is your home. As a responsible homeowner, you want to know every detail of your home. Welcome to another informative video on our Public Health Concern Nepal channel. We hope you watch until the end. This is especially important when it comes to your breasts, an area that requires your attention and care. Breast self-exams, or BSE, are a simple, powerful tool you have right at your fingertips, literally. They are easy to perform and can be done in the comfort of your own home. By regularly checking your breast tissue, you become familiar with what's normal for you, and this familiarity is crucial. This knowledge is key because it helps you notice any changes early on, whether they are lumps, thickening, or other unusual signs. Early detection can be crucial for catching potential problems in their earliest stages, making treatment more effective. Many people think breast health is only for women, but that's not true. Men have breast tissue too, and while less common, they can also develop breast cancer. Men should also be aware of their breast health and perform regular checks. Awareness and education are key for everyone. This guide is for everyone, empowering you to take charge of your health proactively. Knowledge is power, and being informed is the first step. Think of BSE like learning the landscape of your body. Once you know the terrain, you're more likely to spot any unexpected bumps or dips along the way. It's like having a map to navigate your own health. Remember, this guide is informational and should not replace the advice of your healthcare provider. Always consult with a professional for medical advice. If you notice any changes in your breasts, don't hesitate to reach out to your doctor for further evaluation. Early action can make a significant difference. Before we dive into the physical steps of a BSE, let's talk about the importance of observation. Observing your body regularly can help you notice any changes early on. Stand in front of a mirror with your arms at your sides. This is the first step in becoming familiar with your own body. Take a good look at your breasts, noting their size, shape, and color. Make sure to observe them from different angles. It's perfectly normal to have one breast slightly larger or shaped differently than the other. We're all wonderfully unique. Embrace these differences as part of what makes you, you. Next, raise your arms above your head and observe for any changes in the shape or contour of your breasts. This position can reveal changes that might not be visible otherwise. Look for any dimpling, puckering, or pulling of the skin. These can be subtle signs that something might need further investigation. Pay attention to your nipples as well, noting their size, shape, and direction. Changes here can also be significant. Is there any redness, scaliness, or discharge? These symptoms should not be ignored and warrant a closer look. Now place your hands on your hips and press firmly, flexing your chest muscles. This action can help to highlight any subtle changes that might be more visible with movement. This helps to highlight any subtle changes that might be more visible with movement. It's a crucial step in your self-examination routine. Remember, the goal here is familiarity. The more you know about your normal breast appearance, the easier it will be to detect any unusual changes. By knowing you're normal, you'll be more aware of any deviations that warrant further attention from your healthcare provider. Regular self-exams are a proactive way to take charge of your breast health. Now that you've visually inspected your breasts, let's move on to the tactile part of the self-exam. This step is crucial for detecting any changes that might not be visible to the eye. The best time to perform a BSE is a few days after your period ends, when your breasts are typically less tender and swollen. This timing helps ensure that any lumps or changes you feel are not related to hormonal fluctuations. If you're no longer menstruating, choose a specific day each month that you'll remember. Consistency is key, so pick a date that's easy to stick to, like the first of the month. Lie down on your back with a pillow under your right shoulder. This position helps to flatten the breast tissue, making it easier to feel for any abnormalities. This helps to spread your breast tissue evenly over your chest wall, making it easier to feel for any abnormalities. Take a moment to get comfortable and ensure you're in the right position. Use the pads of your 3 middle fingers, not your fingertips, to feel for any lumps or thickening. The pads of your fingers are more sensitive and can detect subtle changes better. Apply firm, gentle pressure in a circular motion, about the size of a quarter. Start with light pressure and gradually increase to feel deeper tissue. There are a few different patterns you can use, but the most important thing is to be consistent and thorough. Choose a pattern that works best for you and stick with it every month. You can move your fingers in small circles around your entire breast, covering every inch of the tissue. Moving in rows like you're mowing a lawn, ensuring you don't miss any areas. Or starting at the nipple and spiraling outward. This method can help you cover the entire breast area systematically. Be sure to examine the entire breast area, including the area under your arm up to your collarbone and all the way over to your breastbone. This area is often overlooked but is equally important. Don't forget the tail of breast tissue that extends into your armpit. This area can also develop lumps or changes that need to be checked. Once you've thoroughly examined your right breast, repeat the process on your left side. Make sure to use the same method and be just as thorough. Take your time and remember, consistency is key. Regular self-exams can help you become familiar with how your breasts normally feel, making it easier to notice any changes. While breast cancer is much less common in men, it's still important for men to be aware of their breast health and perform regular self-exams. The steps for a male BSE are similar to those for women, but there are a few key differences. Since men don't have as much breast tissue as women, it's best to perform a BSE while standing up. Place one hand behind your head and use the pads of your 3 middle fingers on your other hand to feel for any lumps or thickening in your breast tissue. Start at the nipple and move outward in a circular motion, covering the entire breast area. Pay attention to any changes in size, shape, or feel of your breast tissue, as well as any redness, swelling, or dimpling of the skin. Also be aware of any discharge from your nipples. If you notice any of these changes, please see your doctor immediately. Thank you for watching this video. If you enjoyed it, please like and share it to help spread awareness. Don't forget to subscribe to our channel for more informative videos. See you in the next one.